Hey guys, this is Brock from Command Family Medicine. Today we're going to be talking about strep throat and pink eye. Kids are back in school and these infections are very contagious, so we're going to talk about the hallmark signs and symptoms of these infections and some details about treatment. Now, strep is most common in the 3 to 14-year-old population. It's about half as common in adults, and we generally don't see it very often in kids under the age of 3. The hallmark symptoms of strep are going to be an acutely sore throat, a purulent material on the tonsils or swollen tonsils, swollen and tender lymph nodes, and also a fever greater than 100.4 degrees Fahrenheit. And generally there's the absence of cough. If somebody has a sore throat and a cough and they don't have a lot of the other features of strep, it's typically a viral upper respiratory infection. Now, one algorithm that we use to help determine the likelihood of someone having strep is the Centaur criteria with a C. Centaur criteria basically walks you through these hallmark symptoms and asks you the age of the individual, and it gives you a percentage likelihood that someone has strep. This helps us determine who needs to be tested, who may benefit from being empirically treated, and who we can safely avoid testing and treatment for strep. Now, we prevent strep from spreading by hygiene measures like washing your hands, not drinking after each other, not using each other's utensils, and also cleaning doorknobs and other commonly touched objects in the household. And most importantly, we want to avoid touching our mouth, nose, or eyes, and of course wash your hands before you eat specifically. Now, we don't routinely test asymptomatic individuals for strep unless if they have a personal history of acute rheumatic fever, or they would be at high risk for doing poorly with strep should they become infected, or if there is a history of recurrent strep infections in the home. Sometimes it's beneficial to test the rest of the household to see who is potentially carrying it or might be infected without them knowing so. And why do we treat strep? Well, we treat strep in order to prevent it from spreading, in order to decrease the duration and severity of symptoms, and also to avoid some of those possible complications from strep, such as acute rheumatic fever, abscess formation, bacteria actually getting into the bloodstream and someone getting super ill from it, and even strep leading to ear infections. Now, the return to school protocol is going to be 24 hours after starting antibiotics if the individual is fever-free and feeling reasonably well, and usually about 1 to 3 days after starting antibiotics, those generalized symptoms such as fever, fatigue, generalized achiness will start to resolve. Now, when it comes to pink eye, there are multiple causes of pink eye. You have allergic conjunctivitis, you have bacterial conjunctivitis, and viral conjunctivitis. Viral and bacterial conjunctivitis are very, very contagious. They're both typically self-limited, meaning the body will generally take care of the infection on its own, but we generally treat with antibiotics for bacterial conjunctivitis, especially those contact lens wearers, because these infections can turn into more sinister conditions. Bacterial conjunctivitis is generally going to present itself by eyes matted shut in the morning, as well as purulent drainage throughout the day, and it may not be as itchy as viral conjunctivitis is. Now, while individuals with viral conjunctivitis may also have their eyes matted shut in the morning, typically the drainage is going to be more clear, and it's often accompanied by an upper respiratory infection, and the eyes are also usually very, very itchy. Now, it's worth mentioning that if anyone has pain or vision changes with conjunctivitis, it's especially important to reach out to your primary care provider. For bacterial conjunctivitis, usually about 24 hours after starting antibiotic drops, the individual can go back to school. If they play contact sports, we also like them to generally have decreased redness in their eyes. And for viral conjunctivitis, we just treat it like a cold, right? It's very unpleasant, but it's generally harmless. And for that last one I mentioned, that allergic conjunctivitis, this is going to be the individual with a history of allergies who's having lots of sneezing. Generally, they have some bilateral eye irritation, mild redness, and they can also have some watery eye drainage. Which brings us to this month's Command featured service, which is really just telemedicine in general. A lot of our patients know that one of the main features of Command is being able to reach out to your primary care provider if you do have a medical concern. And so just wanted to mention that it's really important, if something's going on, make sure to reach out to your primary care provider. Texting is the most convenient way to do that most of the time. You can also buy something called a B-Bird handheld ear camera. You can actually look at your kiddo's ears and send a picture of what their ears look like to your primary care provider, and that can save you a trip to the clinic, and it can make it a lot easier to diagnose and treat ear infections. Guys, make sure to reach out to your primary care provider if you think you might have conjunctivitis or strep throat, so that we can help triage those who might need testing or treatment, and to make sure that it doesn't spread to the rest of the family. Thank you guys, and we'll see you in the next video.